Hello and welcome to this special interview on World Organ Donation Day that is celebrated annually every year on the 13th of August to create awareness and help motivate people to organ donation. With me in the studio today is Professor Dr. S.M. Bandekar, the Dean of the Goa Medical College and also the Nodal Officer for the Goa State Tissue and Transplant Organization. Welcome, sir, to the show.
Namaste.
So, what is the significance of World Organ Donation Day?
See, the World Organ Donation Day is observed everywhere on 13th of August. Now, this is to create an awareness amongst the people that organs are required and organs are to be donated so that we can save lives of the people who have got end organ disease. Such as a CKD, means chronic kidney disease, or cirrhosis of the liver, where there is a need of the liver. So we need this awareness so that every year people come forward and donate organs.
Right. Doctor, what is the extent of the problem pertaining to the transplant program in India?
The program, the problem is really huge. Right now, if you see in all India scenario, there are 5 lakh people who require organs, and in this 5 lakh people, 2 lakh people require kidneys.
Yes.
And hardly 8,000 kidneys have been transplanted so far. Then if you see the liver requirement, it is almost 80,000 patients require liver.
Right.
But only 1,800 have been transplanted. So, and if you see cornea, the 1 lakh people waiting, we have transplanted only 50,000. So the problem is really huge, and this awareness, and I am really proud that your channel has taken this issue on the right eve of the 13th August. So I feel this problem is huge because there is no proper awareness. There is no proper, conviction amongst the donors. So I personally feel we need to create more awareness. Yes.
Right. Doctor, what is the transplant scene in India and especially in Goa?
In, actually the world's first transplant was done in 1954. And the India's first transplant was done in 1965 in a KM hospital, and that was kidney. And since then, it has gone through a lot of upgradations, changes, and now that we have a TOA Act, that is a Transplants of Human Organs Act. With this, there is a very stringent rules which are governed, and then these rules make you, in a kind of a channelized manner, so that how you could transplant the human organs, and that there is no any mischief in this whole program. And we actually feel that it is doing well, and it has to still improve.
Yes. So like you spoke about the TOA Act, Doctor, I would like to ask you, is organ donation legal in India? Could you throw more light on that?
Yes, organ donation is actually very legal because this act governs the whole process, and it also sees that there is no trade of organs, or there is no kind of money given for the organs, and it is strictly governed by rules and regulations. We have what is called as the program, which is under NOTO, that is National Organ Tissue Transplant Organization. Then we have ROTO, that is Regional Organ and Tissue, and then comes the State Auto. So there are checks and counter checks at each level. So I don't think anything can go wrong in this whole process of organ donation. Yes.
Right. Doctor, is there any system in place for equitable distribution and patient ranking for end organ failure?
Yes, the Ministry of Health and Family Welfare has come up with a NOTP program where there is proper distribution of organs. And in Goa also we have a program which is a software which governs the transplantation of organs as per the wait list and as per the blood group. So there is a proper system in the country. There is also a proper system in the state of Goa, so that there is no misuse of the organs which are procured through the various means, there is one method which is called as a living donor.
Yes.
And in this, though, there is a authorization committee, state authorization committee, then there is national authorization committee.
Yes.
And when it comes to disease donor, now this NOTP has given proper guidelines, and those guidelines are utilized so that you can do proper organ donation.
Right. Doctor, what is brain death? Is it like synonymous with coma? And who can certify brain death?
Actually, many people are making a big confusion on this. Brain death is not actually coma, because coma is one condition when patient can sometimes come back, and also it is called as a vegetative state. So in this there is some hope, because we see some patients of head injury like something called as diffuse axonal.
Yes.
In that these people remain unconscious for quite some time and they come out. Whereas brain death is actually a death.
Right.
And many people don't accept this. Okay, and that is the reason we find it difficult. The any proper means cardiac death, the precedes brain death. Means whenever there is a death, there is a brain death, and subsequent to that there is a cardiac death.
Yes.
So why we talk so much about brain death? Because brain death is the stage where organs can be utilized. If we delay this stage and go to cardiac death, then the perfusion, that is the blood supply to the organs and keeping them viable will not materialize, and then it becomes really difficult to use those organs. Some people say that that organs are taken even in the morgue. This is not correct. This is totally a false.
It's a dead tissue.
It is a dead organ which has no function only.
Function at all.
So it is totally a wrong or a misconcept.
Right. So doctor, what happens, let's say a person is identified as brain dead, or there is a donor who is identified, then what is the process that is to be followed?
Now normally once the donor is identified as a donor, then we explain the relatives, we activate the organ transplant coordinator. Each hospital has a transplant coordinator. Now this transplant coordinator goes to the family of the donor and he explains them everything, what is going to be done, how the organs will be utilized. Once you do that, then there are TPMs, the transplant procurement managers. They maintain the vitals of the patient in the ICU, and these organs are kept viable. Yeah. And then what we do is we select the donors as per the waiting list, and then those organs are allocated. And once they are allocated, there is hardly any time for the transfer. So your time is a big issue here. So you have to do this transplant very quickly.
Right. So doctor, what is the required request, and is it mandated by law for the doctors to approach the family, or the relatives for organ donation?
This required request mandated by law is that next to kin of the patient admitted in ICU who is a brain dead to consider the option of organ donation. Now this is there. See, what we do is in ICU normally the patients are very critical, and some of them come with such a severe injuries, head injury or stroke injuries. So these people are in the ICU, they are already brain dead, and as per the law, when somebody is brain dead, then there are grief counselors, there are counselors who are available in the hospital. They have to approach the relatives or the kin of the patient and explain them as to what is the organ donation. He doesn't demand, he has to just make the whole situation understandable, and then the relatives of this patient will come forward and say whether it is going to be a good human activity or it is for a larger interest of the patients who are suffering from those organ and stage diseases. Yes.
So doctor, this will be a question I think in the mind of many of our viewers. Is there any monetary gain for the family of the donors who are donating the organs?
I don't think we should always anytime talk of monetary gains, because if you talk of that, then that will be the organ business, and we don't
Which the
want
law is against.
yeah, which no law, no country should support and will not support also. There is no such but what our motto says, that anybody who has donated organs, he should have his dignified funeral. That body should have dignified funeral. For that, there is a provision of some financial provision, so that I know we had some two patients. One of them was from outside the state, and we had to provide him transport by ambulance, and those days we had no allocated funds. So for a dignified funeral and his last rites of the donor, there are some provisions of the money, and that is to be utilized as per the SOTO guidelines.
Right. Yeah. Doctor, is there any police formalities involved in organ donation?
I think in the whole organ transplant and the disease donor program, the police plays a very pivotal role. Number one, the police also has to help us in creating a green corridor. Now, what is a green corridor? Green corridor means when you retrieve an organ from a donor, this organ is preserved in a physiological solution, and now this solution keeps that organ alive for certain hours. And this is called as a warm ischemia and it is different for different organs. Like kidney can last longer, whereas heart and lung has to be transplanted immediately. So sometimes when you have to give these organs to a donor or a recipient outside the state, you need to rush from, suppose you take an organ in Goa Medical College, you retrieve it and you have to take it to Bombay. I am just giving you an example. Then you have to take it by road up to the airport. There will be a special flight which will take it to Bombay. From airlifting, it will reach destination of Bombay airport. From Bombay airport to the recipient hospital, it has to go. So it is so vital that police has to provide a green corridor all along. And there should be a coordination between the state police and the police outside the state. The second place where police has a great role is in medical legal cases. Now MLC cases, most of these brain deaths or the head injury patients are vehicular. They are vehicular accidents, and there you need NOC and you need consent of the law. So in that case, we need help of the police to clear those papers so that the donor is ready, everything is smooth. So I think police has a bigger role to play.
Doctor, what does it mean to pledge as an organ donor, and is it like a a binding thing like a will?
No, pledge is like how we pledge many things. It is not a binding thing. The pledge means what happens is the person, suppose some XYZ says, I want to pledge my organs. So whenever he has, God forbid, he gets into that kind of a situation, then that pledge becomes an easy tool for the transplant coordinator to take that pledge and go to the relatives or the next of the kin and explain him that, see, so and so had already pledged his organ. Are you in a mood to give? Are you in a position to accept this pledge and donate this organ? And it becomes a little bit easy. Many people think that if you pledge means you have to give. There is no such compulsion.
There is like a 0.1% that you will end up in that situation.
Exactly, and no compulsion at all. And people who don't pledge sometimes give organs. So there is other way around also. So I don't think pledging means giving. You have to pledge so that it makes the system workable, it creates awareness amongst everybody.
Doctor, in your experience, what do you think is the hesitation to consent for organ donation?
Hesitation is lack of awareness, number one. When these same people who hesitate realize that in their family there is somebody who needs an organ, they come forward immediately. Secondly, they feel that there is a trade on their organ. Somebody is making money. Actually, whatever I told you is the truth. The system is so transparent. Anybody can come and check our SOTO system in Goa Medical College or any other hospital. The system is very transparent. Third thing, there is some belief that if they donate some organ this life, next life they may be born without that organ. Some people have told me also, I don't want to donate cornea because somebody said next life he will be born without eyes or something.
These kind of misconceptions
are there. And brain death. which we tell patient, now your patient is brain death and now he should be ready to donate organ. Some relatives, they feel if they give consent for the organ, they feel that somewhere in ICU he will not be given good treatment, which is not true.
Not the case, yeah.
Which is not
in
true.
fact, the treatment is extra care.
We are giving extra care because we need those organs. We keep those organs viable.
Right.
So a lot of expenses are done to keep these organs viable. So these are a few misconceptions I think we need to overcome.
Right. Doctor, what can the society do to help in this program of organ donation, and what can the medical fraternity do to help in organ
The
donation
society as at large should realize that organ donation is an organ transplantation is a standard procedure as of now.
Yes.
The science has crossed lot of hurdles and it has become a routine operation. And if society knows so many people are living, like I'll tell you, if you don't get organs at right time, people have died.
Right.
And people who got organs at right time are now having a second life.
Yes.
We call it Nave Jivit.
Nave Jivit.
So Nave Jivit, if society believes in Nave Jivit, they should go all out to convince people, or they should themselves come forward and be ready for pledging their organs, or they should spread this news. Medical fraternity is doing a good job, but sometimes medical fraternity also should sit with the kin of the brain dead patients and give them very crystal clear concept as to what is the brain dead.
Brain dead, yeah. Because they are more in connect with the family and the kin of the patient.
Yes.
Right. Doctor, coming to the end, towards the end of our interview, what would be your take-home message to our viewers on organ donation?
The take-home message, I would put it very simple. Right now, the kind of program that we are running, whether it is live donor program or a disease donor program, live donor is between the relations only. The daughter or a father to daughter, mother to daughter, or something like that,
or even
and spouse to husband to wife. So there, convincing them to donate does not arise because they are out of their, they know the need, and this need comes because they are donating to their kin. Whereas here in the disease donor program, they are not donating to kin, but they are donating to some humans who are suffering with end stage organ. So considering this need of the hour, everybody should come forward, and they should also share their awareness with other people. If they know something, some person who has been saved by organ donation, they should share these stories with the others. And then that could inspire others to do the help this program.
Right. Doctor, thank you so much for taking time from your very, very busy schedule, and sharing with our viewers your views and your experience on organ donation and giving us awareness. I hope all our viewers are inspired by your, words, and I hope they come forward in organ donation and we have a much better picture in Goa. Thank you so much for watching this interview. Keep watching Prudent. Thank you.